Good evening. I'm Dr. Tumala. I'm one of the cardiac electrophysiologists with the Kansas City Heart Rhythm Institute. We have several of my colleagues here joining, and they will be introducing themselves. This is Dr. Rajesh Kabra.
Hello, everyone. I'm Dr. Rajesh Kabra. I'm one of the cardiac electrophysiologists with Kansas City Heart Rhythm Institute. And again, thanks for joining.
I am Dr. Fentanis. I'm one of the cardiologists, the Midwest Heart and Vascular Specialist, and I specialize in cardiac imaging, so I'm glad to be part of this group.
All right. And to start off, we'll go on with what is cardiac autonomic nervous system. I think that it is important to understand how the blood pressure is maintained, how the heart rhythm is maintained, in order to understand, what can go wrong and why is this so important. So the heart can beat by itself. The blood pressure is maintained by different levels of nervous system, mainly the peripheral nervous system, and the central nervous system can modulate by sending signals to the periphery through specialized fibers, and it can affect the blood vessel tone so that there is adequate blood pressure maintenance under various circumstances. So if somebody is nervous, their blood pressure can go up. And the reason for that is the central nervous system sends signals to the periphery to make the blood vessels squeeze more blood so that the blood pressure would increase. Similarly, that is called the sympathetic activation. On the other side, there could be a vagal response where the vagus is basically the one that slows things down, makes it more even. So it's like yin and yang, the sympathetic and the parasympathetic systems. Both originate from the brainstem, and then send the signals to the periphery to balance out depending on the circumstances, the person is in. So if they are anxious or if they are exercising, they would need more blood flow to the muscles or to the various organs, and as consequently, by controlling the blood pressure to various organ systems, depending on the needs, the central nervous system and the peripheral nervous system act in coordination. So that is in simple terms. So cardiac dysautonomia is a new thing, although it has been worked up for, probably almost a century to try. Scientists have tried to figure out, how the blood pressure is regulated, how the heart rhythm is regulated by the nervous system. And more recently, after the COVID, there is an increased incidence of the so-called cardiac dysautonomias, resulting in a lot of young people developing symptoms of low blood pressure, passing out, palpitations, etc. So there is an intense research going on since the COVID era. So we'll go into different kinds of cardiac dysautonomias. One is called postural orthostatic tachycardia syndrome. Otherwise, many people know about this condition called POTS. Essentially, what it does is, when the person stands up, the blood pressure tends to drop. Normally, the brain sends signals to the periphery, make the blood vessel squeeze so that the blood pressure would be maintained. That is all happens instantaneously when the person stands. In some people, for whatever reason, that reflex may not work out. When the blood pressure remains low, to compensate for the lack of adequate blood supply to the organs, the heart rate tends to go fast. And that's where the tachycardia or rapid heart rate or fluttering sensation is noted. Sometimes that is not adequate to maintain enough blood pressure and blood flow to the organs, and people may develop severe symptoms and even pass out. There is this second one called neurocardiogenic syncope, and there are different subtypes to it, but all in all, essentially the blood pressure maintenance reflexes get altered. Instead of raising the blood pressure, suddenly the blood pressure can drop, or the heart may suddenly slow down to the extent that it is not, the pumping of blood is not adequate enough to maintain blood flow to the brain, and as a result, patients may become dizzy and may pass out. The good thing of the neurocardiogenic syncope is, people always tend to recover immediately after they pass out. They immediately recover their blood pressure and pulse rate, and typically no permanent harm is done. Then the next condition is called orthostatic hypotension. Basically when the person stands, as I said, the blood pressure is maintained by a reflex squeezing of the peripheral blood vessels, and that reflex is damaged either by some nervous system disorders, for example, Parkinson's, for example, diabetes, who develop neuropathy. Those reflexes can get either blunted or totally lost. As a result, when the person stands, suddenly the blood pressure drops significantly and the person becomes dizzy. And the last one is inappropriate sinus tachycardia. For unclear reasons, there is hyperactivity of the sympathetic system, so that the baseline heart rate, which is normally about 60 to 80 beats per minute when the person is resting in a non-anxious state, it suddenly becomes very rapid, and that rapid heart rate is maintained that way even when the person is simply sitting, or particularly if they stand, their heart rate goes 120 beats a minute faster. All of these things, alteration in the blood pressure and alteration in the heart rate, can lead to serious symptoms. So I will start off, with one of my colleagues. Maybe they can he can enlighten us regarding the inappropriate sinus tachycardia. Rajesh, what do you think? What's your impression? What are the symptoms? If you could elaborate on that.
Sure. So inappropriate sinus tachycardia is a condition where the heart rate stays high. So generally, a normal heart rate response to, say, physical activities is that it goes up, but then it settles down again to baseline when we come to a rest. But in inappropriate sinus tachycardia, the heart rate persistently stays high. So say over about 100 beats per minute all the time, irrespective of whether someone is resting, relaxing, and it tends to go up with minimal exertion. So people can have different symptoms. People can have palpitations or abnormal sensation of their heart pounding fast. They can feel tired. They can have shortness of breath. They can have dizzy spells. So it can present as multiple different symptoms. The way to diagnose is number one, when we check their heart rate in the clinic, even when they are resting, relaxed, it is in sinus rhythm, but it's going pretty fast. And sometimes we put monitors on these patients, Holter monitors, for a few days to a couple of weeks. And what we typically see is the heart rate stays, say, the average heart rate is 90 or more throughout. So that's how we diagnose inappropriate sinus tachycardia. The main management issue is to make sure nothing is driving the heart rate up. So for example, We check these patients for any thyroid functions, abnormalities, because hyperthyroidism can cause increased heart rate. We make sure they have no other reasons. They are not on any stimulants, medicines, which is driving their heart rate up. Once we confirm the diagnosis, then there are different aspects to management, from lifestyle changes, for example, just staying well hydrated, increasing salt fluid intake, wearing compression socks, uh, all the way to trying some medicines like beta blockers, which slow down the heart rate, or there is another medicine called ivermectin, which we sometimes use when people cannot take beta blockers. And in patients who don't tolerate the medicines, or who have symptoms refractory to medicines, uh, our center has pioneered a hybrid procedure which we call inappropriate sinus tachycardia hybrid ablation. So this is a collaborative procedure between us, the cardiac electrophysiologists, and the cardiac surgeons, where we work together to kind of ablate, or to kind of take care of the areas which are in the right upper chamber of the heart, which are driving the heart rate up. And we have seen tremendous success with this procedure. We are a part of some really multi-center, like very prominent multi-center studies, where we are kind of looking at these procedures and systematically collecting data. But in our experience, we have had tremendous success with inappropriate sinus tachycardia ablation. But again, that is when nothing else like lifestyle or medications, nothing works. That's the time when we start discussing these complex procedures.
So it is an invasive procedure, right? The cardiac surgeon works from the outside, from the surface of the heart, and you, electrophysiologists, we work from the inside of the right upper chamber of the heart to ablate this tissue.
That's correct. So yes, it is an invasive procedure, but again, it's not an open heart surgery. The cardiac surgeon kind of goes through the chest, puts a couple of tubes from there, and we put tubes from the legs into the heart. Most of our patients go home on day 2 or so. They spend a couple of days with us, and again, we've had really good results with these procedures. And this is some unique which our center offers in this region.
Yeah, it is, this procedure is done only by a handful of centers actually in the United States, and actually worldwide, to be honest. And we are fortunate to have, uh, excellent cardiac surgeon, and, we are all fairly familiar with, the procedure, and, we have some good results in treating this condition, which sometimes can be very, very distressing for the patients. Uh, yeah, we have published a lot of data on that as well, and we are very happy. And occasionally, sometimes the heart rate can go too slow and may require a pacemaker, but in general, most of our patients do extremely well, and they're off of medicines and leading a normal lifestyle.
I think, the important, you know, thing to remember in a lot of these patients is ensuring other things that contribute to a lot of the physiology being abnormal is also accounted for. And, we tend to do this fairly routinely to check things for like anemia, thyroid disorders that could contribute to a lot of the symptoms that can be similar in these patients. From an imaging perspective, having a detailed anatomical assessment to rule out other causes of a lot of these conditions, especially in our older patients where, autonomic dysfunction can often be seen with, cardiomyopathies that would require more advanced treatment. And in some of the younger populations where there's family history of cardiomyopathy, particularly amyloid, where it can be a mutant variant of the amyloidosis, ATTR amyloidosis, it's important for us to make sure that we have ruled out cardiomyopathies and other causes that can be treated and address those and ensure that patients get the proper treatment. And like you've mentioned, patients don't always tolerate those medications. The beta blockers have side effects. We transition to Vabradine, and oftentimes, despite lifestyle modifications with hydration, exercise, they continue to have symptoms. Having the opportunity to refer them to your service and have that, ablation procedure to improve symptoms and improve function makes a difference in their well-being in the long term. So it's good to have that option for our patients.
The way many patients present to our clinic is, we see a lot of young patients, starting at the age of 18, all the way, very old patients. But it's interesting to, there is a dichotomy in the way they present. Most of the people, most of the patients are very young, those who have developed this cardiac dysautonomia. And then there is other group of patients that are old who have multiple comorbidities, as I mentioned before, like Parkinson's, diabetic neuropathy and other neuropathies. Uh, so they can also develop those. So the younger population tends to develop neurocardiogenic syncope and postural orthostatic tachycardia syndrome, or POTS. And the older folks tend to develop orthostatic hypotension. Basically, their blood pressure drops because the nerves are damaged, and therefore they cannot control and maintain the blood pressure. And blood tends to pool when they stand up, pool in the legs when they stand up. So those patients, their main problem is just simply lightheadedness whenever they stand. Whereas the younger patients have multiple symptoms. They complain of palpitations, they feel fluttering sensation all the time with minimal activity. They complain, they have dizziness whenever they stand up, or sometimes even in severe cases, even sitting up can lead to dizziness, and occasionally they tend to pass out. And I have patients who had, passed out multiple times. Fortunately, most of them do not result in injuries because, patients will be having some warning signal, at least few seconds before, and therefore they were able to sit down and protect themselves. Then the other symptoms that happen is fatigue is a very common thing for these patients. Whether it is related to low blood pressure, that is because, the muscles are not getting enough blood supply, and therefore they feel fatigued, or they have typically coat hanger, a type of weakness and aching, particularly of the shoulders, around the neck area, and above the scapula. Uh, and then the other thing is also they have exercise intolerance. They cannot exercise. These young folks, when they are in their 20s, they're going to college, they're getting into the workforce, etc., and they cannot do their jobs or do exercise, and they cannot enjoy their life. Uh, that is unfortunate. So they have a lot of symptoms. Uh, there is not one particular thing that they complain. They have a multitude of other symptoms, such as, for example, gastrointestinal. They have nausea. They have constipation and alternating with diarrhea. They have other conditions like irritable bowel syndrome, or not able to tolerate food. not able to tolerate salty food, not able to drink enough water, etc. Those are the extreme patients. I have seen some patients who required even, a gastrostomy tube put in because they're not able to retain enough water. They had to pump water into the stomach directly. So those are some of the symptoms, and these symptoms tend to get worse when they stand up, etc., or do any kind of exercise, or particularly, there are some patients, the neurocardiogenic syncope patients, particularly, they tend to develop these symptoms, particularly when they are in a hot environment, when they are under stress. For example, giving blood draws, needle sticks. All these are triggers that sends the signals to the brain, and reflexly, the brain sends the signals to the periphery. And instead of raising the blood pressure and the heart rate, they become counterproductive, and they slow down the heart rate or blood pressure or both, and that results in passing out spells. They tend to recover very, very quickly. We always hear of these patients, these young people standing in line, and suddenly they become queasy, uneasy, start to become pale, and then pass out. And as soon as they hit the ground, they are awake. The good thing is they feel all right after that. Okay, unlike people who have seizures. Sometimes when the blood supply to the brain is not adequate enough, sometimes, you can even see some people like seizure-like activity. So, although in such patients, typically they tend to go to the neurologist, have their, checked out, to make sure that they don't have any seizures, and then they get referred to the cardiologist. Sometimes it may be worthwhile just doing both neurological workup as well as cardiovascular workup evaluations, so that we can get to the bottom of this problem much more quickly. Some of the diagnostic tests, what we do in our labs is, one is Dr. Cabra mentioned already, that we use prolonged cardiac monitor to see, how their heart rate behaves, whether it is persistently high or does it go up and down. And we also do echocardiogram to see what the heart muscle is. Is it thick? Is it functioning normally? Is it squeezing normally? Are there any valve problems? As Dr. Fontanes explained, sometimes there are conditions called amyloid heart disease, and that can also affect the peripheral nervous system. So it's a double whammy. So those people can also develop this, orthostatic hypotension. It is important to recognize those conditions. So we do the echocardiogram, and if necessary, additional testing to rule out the amyloid. The more specific ones is the tilt table testing. We also measure sweat volume in response to stimuli, chemical stimuli. We check how the heart rate responds to deep breathing, because that might indicate the vagal tone, how it affects the heart rate. Then we also ask the person to take a deep breath and blow out, and we see the heart rate and blood pressure responses, and that's called the Valsalva maneuver. And we measure these two things, how they interact with each other. Normally, when the person blows out against a closed glottis, basically, you're trying to hold breath and try to breathe out, the blood pressure tends to drop. And as a response, the heart rate wants to go up to maintain adequate blood flow. And if that doesn't work, if they are not in sync, and if they are imbalanced, then person can develop really low blood pressure and inadequate heart rate response. That gives us some ideas about what may be driving these symptoms. So those are called autonomic reflex testing. And lastly, we do the tilt table. We basically strap the body to the table with footrest, and we elevate the head under the bed and keep monitoring for blood pressure changes and heart rate changes for about 30 minutes. There are different protocols for that. Some people do for only 10 minutes, but our lab, we tend to do it for 30 minutes because we think it gives us a better idea. Many people with postural orthostatic tachycardia syndrome, or the POTS, may not be able to tolerate the entire 30-minute, and they may develop symptoms right away, and sometimes, rarely, they may even pass out, and then we immediately return the patient back to a lying position, and the heart rate and the blood pressure immediately responds back to normal. So we have good technicians, who watch every moment, and they will watch how you're responding to all this testing, and we get a report, and based on that, we will tailor your treatment depending upon what the condition is. Sometimes all you may need is a beta blocker, if you have a inappropriate sinus tachycardia. And Dr. Cabra mentioned earlier that you could use some other medicines, and if that also fails, we can refer you for this IST procedure. The key to many of these conditions is maintenance of good hydration, adequate salt intake, so that the blood pressure could be maintained. Avoid conditions that can cause dehydration, for example, drinking too much coffee or tea or energy drinks. They might increase the heart rate and let you cause dehydration by diuresis. They will let fluid losses. Some of the other things that a patient can do on their own is try to avoid triggering conditions. So many patients can recognize what the triggering factors are and try to avoid those. And regular exercise, healthy habits, eating regularly, no starvation diets, etc. And small meals multiple times, I think that would help. Regular exercise, a lot of patients may not be able to walk or run, and I would recommend reclining bike exercises. Sometimes just standing at the corner of the room, just to train your body to be able to tolerate these blood pressure responses, would also be of help. If those all are not working for you, then we can prescribe some medications, compression socks, etc. So lifestyle changes, eating regularly, keeping hydration, avoiding triggers, all these things help. Anything, Dr. Fentanis, that you want to add?
Yeah, no, I think you've mentioned all the important things where, lifestyle modification makes a big difference. Obviously, if the symptoms are incapacitating, this can be a lot more challenging, but once you're in an appropriate therapy, it's extremely important to ensure that, like you mentioned, patients do maintain physical activity, adequate hydration. A lot of us are very dehydrated for long periods of time with being busy at work or doing things that distract us from drinking, but things as simple as setting reminders on the phone or the watch to tell you to take a minute and breathe and hydrate and drink plenty of water will really make a difference in a lot of these symptoms, and it'll definitely help with the tolerating of medications as well as overall well-being. So All really good points.
Dr. Tomila, this is Rajesh here. So I
Uh-huh.
think one of the questions where I would seek your kind of further explanation is how does autonomic nervous testing help uh, above and beyond tilt table testing? So why do these patients benefit from autonomic nervous system testing, and how do these results help in their management?
So the autonomic testing helps, to figure out if peripheral neuropathy, for example, the Q-SORT test that we do, the sweat testing, it would help us figure out, if peripheral nervous system is at fault or central nervous system is at fault. So the vagal tone is measured through the heart rate variability to deep breathing, and the sympathovagal balance, that is the sympathetic system versus the parasympathetic system, the balance is determined, we can figure that out, by looking at the Valsalva maneuver test. So different small components are identified with each of these. And for example, if I see that the main problem is lack of for example, lack of heart rate variability, I might say, there is heightened vagal tone. So maybe if the person is exercising too much and that is causing the symptoms, back off on the amount of exercise. That might help, let the vagal tone down, and that might help. Um, the other thing is about the Q-SORT, the sweat volume response test. That would help us identify if there is anything peripheral neuropathies are causing, or their medication, for example, those act on the central nervous system. The anxiety pills, some of them can cause alteration in the blood pressure response, so we need to maybe back off on those medicines. Maybe the patient may need to be referred to a neurologist to further assess, whether it is truly peripheral neuropathy or some other central nervous system condition that is causing these kind of responses. For example, orthostatic hypotension. Definitely we need to involve a neurologist, because some of these degenerative diseases can cause really, horrible symptoms, that the patients cannot function, lead a normal life.
That's a great explanation. So, so I think what we are trying to do is to figure out what if number one patient has autonomic nervous system dysfunction, and at what level, and it might help us kind of make appropriate management changes, including referral to neurologist. So I think that's very helpful.
Are medications effective for these disorders? Yes, they are. Sometimes there is no shotgun approach for these kind of conditions. Sometimes you have to try smaller doses and then increase the dose gradually depending on the symptom response. So sometimes we have to use a combination of medicines to get adequate response in addition to the lifestyle changes. So that's one has to really be patient, to be able to get through this treatment regimen until they kind of stabilize and the symptoms are improved. So that's very important. The second thing is, the question is it curable? Are these conditions curable? For example, inappropriate sinus tachycardia, yes, we can do surgical ablation, and that might be able to cure the person. Whereas with the neurocardiogenic syncope, avoiding the triggers, as I mentioned, all those things would help. Usually, since this affects the young patients, my experience, and many others have this experience, is that their symptoms start to gradually improve over time. It may take few years for the symptoms to go away, and they may be able to lead to normal life. The question the researchers are still trying to figure out why some people experience resolution of their symptoms. Why is it age related? Is this related to some kind of viral infections affecting the nerves on a temporary basis? So there are a lot of unanswered questions in this area.
I think you did a really nice job going through the big picture of what dysautonomias are. I I would just add that the symptoms from cardiac dysautonomia can be very debilitating, and and again, it predominantly affects the younger individuals who are either college students or early career people, and it may be they might be having multitude of stressors around them. So the important thing is people should not ignore their symptoms and should seek medical help. Uh, I think in the era of smart watches where they give you alerts when your heart rate is extremely high or fluctuating, I think those may be some clues to autonomic dysfunction. And what you mentioned, post-COVID, we are seeing more and more of long COVID syndrome, where autonomic nervous system is affected. People just have symptoms which are not explained by involvement of lungs or heart. So I think these are the symptom clusters which should prompt patients to seek help in their most productive time of their lives. So, Dr. Fentanas, do you have anything else to add?
I think you mentioned it a lot. We saw a lot more increase in patients with these symptoms following COVID infections, especially more significant COVID infections. And like you mentioned, there's a lot to be done and a lot to be said about what the mechanisms are, a lot of uncertainties, a lot of opportunities for research. But as you mentioned, also a lot of folks with pretty debilitating symptoms. And with the new technologies, like you mentioned, Apple Watches, Fitbits, all of those devices that allow for continuous heart rate monitoring and wearables, we're starting to pick up and realize that a lot of these patients sometimes have subtle things that gradually increase, and a lot of folks tend to just have adopted to that physiology and have changed their way of living in order to minimize those symptoms, but also not being able to experience some life to the fullest. So, we want to make sure that people who have these symptoms get the treatment that they need, but more importantly, they get the diagnosis that they need. So that's what I would tell our patients, that if they notice something's wrong with their heart rate on their wearable, and if they're having symptoms, that they shouldn't just dismiss it, especially if it progresses, if it persists, and more importantly, if it worsens. So we want to make sure we can leverage whatever information they have for us. And at the end of the day, nobody's going to know their bodies better than they do. So if they know that something's not right, something is changing, we need to be intentional about trying to figure out what else we can do. So it's great to know that you guys have all of these advanced tools for diagnosis, particularly the autonomic testing. That's really hard to find, folks with the equipment, the technicians, the technologists, and the, more importantly, expertise to know how to interpret that. So that's something that we want to make sure our patients understand, we want to take advantage of, and make sure that we get them to the right folks at the right time to get the right answer. So that's really good to know.
So if I may add, there are two things that, Dr. Cabra has mentioned about the smartwatches. Now there are multiple types of smartwatches available uh, that would be able to monitor the heart rhythm all the time. And there are other things like cardiomobile, which is a very simple thing, which is very cheap nowadays, that most patients would be able to afford it. It would be a good addition if somebody could not afford a smartwatch. The other thing I would recommend is, buying a blood pressure machine, automatic blood pressure machine for home use. I think when the patients, when they develop symptoms, I think it is essential that they check their blood pressure and pulse rate at that time and note it down so that if they bring that information to their doctor, they'll be able to understand much better and be able to make a diagnosis quicker, because that would give us some objective data. And also that same information can be used to see how the treatment is going on, whether it is effective or not. So those kind of simple things, that patients can do to help us reach a diagnosis quicker. Now, the other thing I just want to mention is besides the monitors and stuff, many young patients, they tend to have associated conditions, as I mentioned earlier. Besides that, there is, collagen disorders like Ehlers-Danlos syndrome, where people have joint dismobility or dislocations, etc., loose joints. For some reason, they tend to have higher incidence of these parts. We don't know the exact association, why that is. Hopefully, in the near future, research will be able to solve that conundrum. We'll be glad to help you in any other way. You can talk to your primary care physicians to get to the proper diagnosis and treatment. Thank you, Dr. Cabra, and thank you, Dr. Fentanis. On behalf of KCHRI, this is Dr. Tumala signing off.